Maraming salamat po. To welcome us all sa ating 31st Kapihang OH, ladies and gentlemen, our PCOM Quezon City Chapter President, Dr. Kathyrn Natalie Uy Tan.
Salamat, Dr. Cabigon. Magandang gabi po sa inyong lahat na aming tagapanood at tagapagsubaybay. Mula sa iba't ibang panig ng Pilipinas at sa labas ng bansa. Sa aming kapamilya sa Philippine College of Occupational Medicine, mga kapuso sa Occupational Safety and Health, at kapatid sa propesyon ng kalusugan. Isang mainit na pagtanggap mula po sa amin dito na bumubuo sa PCOM Quezon City Chapter. Ang pandemya dala ng COVID-19 ay patuloy na nanalasa sa bansa sa loob ng mahigit na isang taon. Sa pangkasalukuyan, nadagdagan pa ang problema dala ng pagsulpot na iba't ibang variant ng COVID-19 na mas mapanganib. Ito ay nagdulot sa ngayon upang mapilitang ipatupad ang mahigpit na restriksyon at seguridad, lalo na sa National Capital Region, kung saan madami ang naitalang kaso. Ang ating mga mamamayan ay patuloy na nakikibaka sa panganib na dala nito upang matugunan ang pang-araw-araw na pangangailangan ng kani-kanilang pamilya. Ang sektor ng kalusugan ay patuloy na nakikipaglaban ng buong lakas para malabanan at masagip ang buhay ng mga nahagip ng sakit na ito. Dala ng matinding pagsubok at mapaghamong kalagayan ng ating ekonomiya, hindi maiiwasan ang epekto dala nito sa ating kaisipan at puso sa bawat isa, lalo na sa mundo ng paggawa. Kaya po ngayong gabi sa ating virtual na pagtitipon-tipon, kami ay lubos na nalulugod dahil kasama po natin ang isa na naman eksperto sa larangan na ito para talakayin ang addressing the mental health issues in the workplace sa ating ika-31 kapihan. Tara po, tayo ay sabay-sabay na makinig at matuto ngayong gabi. Maraming salamat po at isang ligtas na gabi po muli sa inyong lahat.
Thank you, Dr. Carriaga. Our dearest colleagues and to all our beloved guests from all sectors of the workforce, we are very honored at napaunlakan tayo ng ating panauhing pandangay ngayong gabi. Our speaker for tonight completed her psychiatric residency at the National Center for Mental Health, where she later became a consultant of the outpatient section, the former chief of the pre-admission unit, the co-chair of the Adverse Drug Reaction Board, and a medical specialist 3 at that very institution. She got her medical degree from the De La Salle Health Sciences Institute. She also finished her masteral course in management, major in hospital administration at the Philippine Christian University, a fellow of the Philippine Psychiatric Association. Ladies and gentlemen, let us all welcome Dr. Kathyrn Natalie Uy Tan.
Hello. Hello. Mic test.
Go ahead, Doctora.
Okay, hello. Good evening to our constituents. Thank you for having me, the Philippine College of Occupational Medicine. Despite our situation right now, it's very timely that we will be tackling about mental health. It's actually very surprising for me as a psychiatrist because admittedly, when I started residency, psychiatry was not popular at all. But lately, it's been a subject of interest because now we appreciate how important mental health is. And especially in the workforce and that we are facing a pandemic, mental health is one of the highlights of this season. So I was asked to discuss what are the benefits for our physicians in occupational medicine to manage cases of mental health challenges, particularly in the workplace, and whether there are ways that we can alleviate symptoms or challenges that employees are experiencing in the workplace, especially that we are all facing the pandemic. So this is the 31st Kapihang OH, and we are addressing mental health issues in the workplace. Next slide. So according to the CDC, mental health disorders are the most burdensome health concerns in the United States. And they say about 1 in 5 of adults report any mental illness in 2016. So possibly at present, there could be more. We would like to take note, although there is said to be an influx of cases of mental health disorders, there is a high probability that these patients may have already an existing disorder, but the symptoms came about, especially with the multiple stressors that we are experiencing, particularly the pandemic. And then aside from that, 71% of adults report at least one symptom of stress. So when we say stress, it's not necessarily just in terms of mental health. It could also be manifested physical-wise. So it could be gastrointestinal disturbances, it could be muscle strain, it could be headache. So I'm pretty sure you're familiar with those symptoms. And then aside from that, patients who experience mental health disorders usually have also physical conditions. And with that, there would also entail a lot of expenses for those employees, because their concern is not just physical health, but also mental health. So their experience is their expenses may be 2 to 3 times higher than a person without these concerns. I would like to share, for example, I am actually a person with physical disability. I think one of the things that increases my expenses would be my mode of transportation. So I cannot drive. I need to use a Grab. So a lot of my budget goes to these types of expenses. So I think these are the concerns that we also have to take into consideration when we deal with these patients. Next slide, please. So I would think as a business owner or an employer, why is it important to consider the mental and physical health of my employees? And then ultimately, it's the cost. So in the US, this is according to the CDC, for dealing with dealing with mental and physical conditions of your employees, possibly preventing these problems would actually save you billions of dollars annually. And then aside from that, according to the World Bank, there is a favorable benefit in cost ratio. So the cost ratio is 2.3 to 3:1. And then the economic benefit is about 5.7:1. So at the end of the day, you save more money in terms of like employee turnover, absenteeism, even the term presenteeism. So it may be your employees are present, but they're not fully functioning. So we would have to consider that. That's why it's very important to take care of your employees. Next slide, please. So why is it very important to focus in the workplace? Actually, the workplace is a great opportunity to manage our mental health? Well, aside from a lot of our time is spent in the workplace and we are expected to function, the workplace has is designed to entail us to do certain activities, and it's an opportunity for us to identify those who are at risk for these issues. And then aside from that, it's also our opportunity, once we identify them, we can connect them to those who can help them. And then aside from that, we can also provide support and perhaps reduce or manage the stress. Next slide, please. So one major problem is
Hello, Dr. Tan. We cannot hear you. Hello, Dr. Tan.
hello. Yes, yes.
Yes, and now, yeah, ayan.
Sorry
Okay
for
na
the
ulit.
technical difficulty. Okay.
No worries. Go ahead.
Okay. So in general, the problem is if mental health issues will in turn affect our businesses. So it's very important that we address our issues for our employees. So next slide. So what happens when our employees experience poor mental health? So in general, they have poor engagement with work. So their interest, their attitude towards work can be negative. Aside from that, they may have impaired communication with their co-employees or even to their managers. Also, job productivity may be affected. And then aside from that, daily functioning and physical capability may decrease. So basically, their output would decrease and in turn affect the business. Next slide, please. So for mental illnesses, such as depression, are associated with higher rates of disability and unemployment. So we know depression would interfere with a person's ability to complete physical jobs, and it also reduces our ability to do some cognitive performances. So the estimate is there's a decrease of the ability to complete tasks by 20%, and then about 35% when it comes to cognitive activities. The problem is there are only few people who would approach us and admit they have a mental health problem. And then aside from that, these few people, a smaller percentage would actually be able to get treatment. So according to the UN, actually, 49% would come forward with a mental health symptom, but only 6% would be able to get these forms of treatment. Next slide. So actually, even after taking health risks like obesity and smoking into account, employees of higher risk of depression also have a higher risk of healthcare costs. And this study was done 3 years from the time that these patients are screened. So depression is actually a very important factor for us to identify among the employees. Next slide. So what can we do about these situations? So one very important thing is to promote awareness. It would also be great to have that atmosphere that we are allowing employees to open up to what problems they are experiencing. And then aside from that, perhaps it would also be great for the company to have programs entailing to stress management. And aside from that, it would also be great to have programs that would combine both physical and mental health interactions. So again, as I mentioned earlier, that the workplace is an optimal setting to promote mental and physical health. So why is that? So first of all, there's already a structure for communication. So from the top, you can promote mental health through emails, through links that you find from reputable sources, or from brochures that you can print out and share with your employees. And then aside from that, the employer can make programs and policies in a centralized manner that can be disseminated for your employees. And then aside from that, employers can also offer incentives for their managers, their supervisors who would reinforce these healthy behaviors. And also, from the information that you gather from your employees, perhaps you can utilize the data and see whether your programs have a positive effect on your workforce. Next slide. So, what can employers do to help their workforce? So it's very important, first of all, to have a self-assessment tool that is available, because it's not exactly a, a immediate topic of conversation when it comes to concerns of mental health. So maybe if your employees have a tool to assess themselves, maybe they would be more aware and be insightful of what they are experiencing. And then aside from that, we do know there is a hesitation to approach that we have a health problem because we are thinking of the cost. So perhaps our employers or our company can offer subsidized or better free screening and clinical referral to those mental health professionals like me. And then aside from that, it would be great if the company could offer health insurance. So our employees will not be that worrisome about expenses, considering we are in a pandemic and expenses is a really important consideration, I think, for our everyday life. And then aside from that, maybe these companies can offer life coaching, counseling, and management programs that would be utilized from management up to the workforce in general. And then uh, aside from mental health in general, it would also be great to have programs that are geared towards stress management, and then physical enhancement, and then probably also financial literacy. I think that's one of the important things that we would consider in terms of our overall well-being. And it'd also be great for companies to have a quiet area where you can rest even for a bit. Or maybe if you want to tune out from the workplace, if you feel very stressed, it would be great to have like a safe space for our workforce. Next slide. So aside from that, it's also very important that our top tier managers, our supervisors are able to identify the needs of their employees, of their workforce, and to recognize if there's a problem and to be able to deal with it. So it's great that we have lectures like this so that we can tackle dealing with mental health or psychiatric disorders that you may be uh, possibly diagnosing in your clinics. And then aside from that, it would also be great to empower employees to participate in decision making and creating these programs that they may perceive to be helpful to them, because especially that they're the ones on the ground, perhaps they have some solutions to their problems. Next slide. So what can be done? So for us healthcare providers, one thing is to investigate our patients regarding symptoms of possibly depression or anxiety. So perhaps your patient may come in with upset stomach, muscle strain, but perhaps these are just some physical symptoms that are manifesting, but actually our patients are experiencing something else. So perhaps you would have to consider also a psychiatric diagnosis. Aside from that, it would also be great to offer some screening, treatment, or other services like if the company is partnered with a psychological center, perhaps the patient would be able to avail psychotherapy services. So another thing is to have a holistic approach. So you can utilize uh, other uh, departments and other specialties, so such as social workers or occupational therapists or physical therapists or psychologists to address the issues of your client. Next slide, please. And then for the workforce and specifically for mental health, psychiatry is very dynamic, very fluid, and we have a long way to go. And we still are very open to new knowledge and to new information that we can apply to the workforce. So it would be great for those who are interested in research and particularly in occupational medicine coinciding with mental health, it would be great to design something that would help us evaluate and perhaps implement some programs that are applicable in the workplace. And then aside from that, it would also be great, like I mentioned, something that would entail the employee to have a self-assessment scorecard. So perhaps they would have a guide to see whether maybe they have a problem and maybe I would need to talk to my doctor about it, and perhaps my doctor could refer me to a psychiatrist. And then aside from that, we need programs for the employees to demonstrate and are evidence-based for the workforce. And then aside from that, it would be great to have training programs for leaders and managers. Perhaps this would be in partnership with business schools or learning platforms that would allow these people, these managerial level people, to identify problems among their workforce and to be able to address it. How about the employees? What can they do? So as an employee, I would say it would be great if the employees themselves would encourage your employers to offer these programs to help them. So perhaps they can make suggestions, they can do their own research. It's like, hey, this program that is applied to a certain company, maybe this can be applied to our company. And then perhaps they could also consider like the budget and the feasibility and the type of people that you work with. And then aside from that, since you have the power to suggest these programs, it would also be great when you all participate in these programs. So when you see when your employers see that you are engaged in the programs, perhaps they will be more encouraged to have these programs in place. And then aside from that, have apply some learning in terms of mental health. So we have information right now. We have the internet right now. We can actually teach ourselves how to manage our mental health. So with that, we can improve our resiliency. We can improve our mindset and our attitudes in terms of our mental well-being. And then aside from that, let us participate in trainings. Well, I mentioned earlier about financial planning. I think it's one important aspect that would keep us sane. Uh, and then aside from that, dealing with unacceptable behavior and or attitude among our coworkers. And then aside from that, it would be great to exercise empathy, openness. And if you have a personal experience and you see that situation would be beneficial or helpful for your colleague, perhaps you can share it with your colleague, and maybe that colleague can find it as an inspiration to help him or herself. And then aside from that, uh, practice practice behaviors that would promote mental or physical health. In general, basically, mental and physical health, they coincide. And for you to be mentally strong, it's also very important that you take care of your body. So taking care of your body would entail you to eat right. And when I say eat right, I know we all know you're supposed to eat more fruits and vegetables. You're supposed to avoid fat and sugary food, avoid fast food, try to cut down on caffeine, uh, and then also manage your portions, because there are times you want to treat yourself, but you have to manage your portions. And then aside from that, it's very important to exercise or just keep moving. Uh, we are in an environment that we are usually sitting down, so maybe we could stand up more of the time and be more mindful of what we are doing to our bodies. And then perhaps we can allot a certain period of time in our day that we can do some cardio exercises or some strength training if we reach above 30s. And then aside from that, very, very important is to have adequate sleep. I mean, you need sleep more than exercise or eating, because you cannot function if you have inadequate sleep. Uh, I think that would be one of the issues for our workforce, especially those who tend to shift their time a lot. Um, so perhaps you can advise them about sleep hygiene, about cutting down caffeine, uh, and then about prioritizing sleep when they are able to uh, be home. So next slide, please. So especially with the pandemic, we are very limited in terms of being able to interact with family. Well, sometimes family. Well, especially for those who are working at the health sector, we are very careful in interacting with our loved ones and also with our friends. We are not able to socialize physically, but it's a good thing that we have these online platforms that we can gather, we can talk about topics, we can learn from each other, and we still can communicate. I would point out, imagine if we experience this pandemic and we don't have the internet. It's like it's gonna be one very difficult experience compared to what we have right now. So despite our current situation, it's very important to keep that social connection, to build on it. And perhaps at the end of the pandemic, we can all uh, rebuild those social interactions. And then, even though we are having a lot of difficulties, there are still things to be thankful for. Um, well, one thing, I am thankful for being negative on my recent RT-PCR, and also for my colleagues at work who are mostly negative. So uh, there are always reasons to be thankful. Another thing I could also be thankful for is I'm in a profession uh, right now that is really in need and can help a lot of people. So I think it's truly a blessing that we are doctors, we are in this profession, and we can alleviate the problems of our workforce. So aside from that, knowing that we experienced such a difficult time, I would also encourage people to keep growing, continue learning, practice discernment in terms of information. Like I mentioned, we have a lot of information that we can gather from the internet, but not everything that we see is necessarily true. And maybe the things that we post on Facebook or social media, we also have to be careful that these information are well-meaning, would be useful for those who would read it. And then it's different for some people because for some people, uh, they would some people would rather steer away from those information. It could probably bring them stress. But for my sake, I like getting information because it prepares me to handle difficult situations. So I think it depends on what you perceive your needs are or what your workforce would need. So I think it's a case-to-case basis for some people. Okay, next slide. And then at the end of the day, when we experience mental health problems, we always have to recognize when we're supposed to seek help. So at the National Center for Mental Health, we have a crisis hotline. So the numbers are flashed on your screen. We also have a toll-free number for Luzon. And then aside from that, well, right now I'm a consultant. I'm the deputy chief of the outpatient section. So actually, if you would like to have outpatient consult, you would have to go to the outpatient section page of National Center for Mental Health at Facebook, and there's a link there that you would have to register to be able to set an appointment. So we are geared towards being able to come to our clients through telemedicine. It's very challenging, but at the same time, we are adapting. I think it's high time that we did it because admittedly, we lack psychiatrists, and it's been a problem because we have a lot of patients coming from all over the Philippines. So now we're using telemedicine, and perhaps even after the pandemic, this is our way of being able to reach more patients all over the country. So with that, so I thank you for your attention, and I hope to answer your questions. So safe evening.
Thank you very much, Dr. Tan, for that insightful discussion. I personally find the personal scorecards so very, very interesting. To moderate our open forum, may we call my co-host, our Chapter Public Relations Officer, Dr. Margo Venus Gasalla Pu. Take it away, Dr. Pu.
Thank you, Dr. Jason. Dr. Tan, are you ready for the question and
Yes.
question part, question and answer? All
Yes.
right. Sige. Sisimulan ko na po sa ating mga nakuhang questions from our participants. Gandang gabi. Okay.
Hello.
Can you, is there a way for us to know kung saan po kami po pwedeng makakuha ng mga mental health assessment tools that we can use for the employees?
Well, we do have screening
Or kami po
tools.
dapat ang gagawa nun?
Yeah,
Yes.
actually, it's something that researchers would probably have to develop. That would be geared towards specific areas in the workforce. So I saw a while ago that there's a sector in finance, in hospitality, and stuff like that. So maybe it's a topic that needs more research to develop. And then whether it's not just develop, it's to see whether it's applicable for these sectors.
I see. But right now, ano po kaya ang pwedeng magamit? Like general, ano po na assessment tool that we can use?
Okay, we do have screening tools for depression and anxiety, but we usually utilize this if we are seeing if the management is improving. So it's like a baseline. Well, but at the end of the day, I think we also have to, at the very beginning, be able to diagnose these disorders. So as of now, for the workforce in general, I'm sorry, I'm also very limited in what can we utilize for the lay person. But I think it's something that needs to be a subject of study.
All right. Doctora, there's another question that is, I think, connected with my first question. Can you cite specific holistic mental health programs and activities that can be done in the workplace? And what would be the best evaluation tool? So medyo connected po yun.
Okay. So I think I already mentioned about the evaluation tool, but we have screening tools about depression and anxiety. But I would also have to consider that there are a lot of psychiatric disorders. So I think at the end of the day, it still comes to what is the diagnosis of your patient, and I think if there is a consideration that your patient would require a consult from a psychiatrist, I think that would be a proper referral. And then aside from that, other holistic programs that we can utilize. So like I mentioned, the mental and the physical, they go hand in hand. So maybe programs about meditation. Perhaps you can have programs on yoga, on maybe programs on physical health like calisthenics, Zumba, and stuff like that. You can also maybe, like I also mentioned, I think this is very, very important for us Filipinos, like financial literacy. I think it's a major source of stress for all of us. So generally, programs that could help our employees grow as a person. Aside from that, perhaps also programs on communication, uh, perhaps even a little bit of programs about psychology. So we do see these programs on educational platforms. Some are free. And then it's also quite a reward when they receive like a certificate, right? So it could also be something to entice your employees to join these programs. Um, but generally, it's I would say programs that would not just gear towards the mental health, but also the physical health as well, because they go hand in hand.
All right. Doctor, in the process of screening employees, can we include mental health assessment to screen them?
That would be great. But I would like to point out, like I mentioned, sometimes they would approach you with a physical problem. That could also be a manifestation of something that is psychiatric. But actually in psychiatry is actually a diagnosis of exclusion. At the end of the day, the first thing that we have to do as physicians, and then if you're considering a psychiatric illness, the first thing we have to do is rule out a general medical condition, because there are some medical conditions that can manifest something psychiatric, but it's actually a physical problem. So example, like if you have hyperthyroidism, it can manifest something that is likened to having a manic episode, a bipolar affective disorder manic episode. For those who have hypothyroidism, could manifest like depression. Some may some people may be actually be experiencing seizures or strokes, but the manifestation could be psychiatric. So I think that's one thing that you have to rule out first. So that would entail a lot of diagnostics. And then another thing is, I mentioned anxiety. So maybe your patient could be experiencing palpitations, or like symptoms of fear or anxiety, but I think you have to rule out other problems like thyroid problems and cardiac problems before you say it's psychiatric. And then other than that, if you totally rule out a physical problem, you would also have to rule out uh, the manifestations due to substance problems. Not necessarily taking caffeine, not necessarily taking illicit drugs, but there are some medications that can also seem to manifest like a psychiatric disorder. So, example, there if patients are in steroids for
Mhm.
steroids, they can manifest like mood swings or symptoms of depression. Actually, beta blockers, statins can manifest. Patients taking these medications can manifest depression. So at the same so what I'm pointing out is, although yes, there are screening tools for these symptoms, at the end of the day, it's very important to know clinically when to say these disorders are psychiatric in nature. And then at the end of the day, if you see a patient with a psychiatric condition, I would still say it would be best to refer to the specialist. Admittedly, it's not as easy as it looks to diagnose a person with depression. I've encountered uh, even our training residents who have that impression of depression, but it can be other psychiatric disorders. So I would say if you have a high probability that your client has a psychiatric disorder, refer to the specialist.
Alright. How about lifestyle changes like dieting? Kasama rin po ba yon as a psychiatric manifestation?
Dieting. Well, I would consider it. So one of the things that I would consider if it's excessive. Well, first of all, when you say something is psychiatric, uh, I would say there is a dysfunction in terms of like how the person interacts with other people, how the person views him or herself, how it affects his or her work or studies. So when in terms of dieting, perhaps if it's too excessive, so maybe if it's like too calorie restrictive that the patient is already emaciated, so I would think these would I would consider anorexia or perhaps also body dysmorphic disorder. But at the same, like I mentioned earlier, we still have to rule out a physical problem. So what if the patient has controlled eating, but actually the patient is experiencing easy satiety. So maybe I would consider a gastrointestinal problem first before I would consider something psychiatric. So at the end of the day, we have to rule out a general medical condition. We have to rule out uh, the symptoms due to substances or due to drugs before we can say perhaps we can refer these cases to a psychiatrist.
Okay. Doctora, what are the best tools in the prevention of bullying in the workplace? And a question after that is something to do with an assessment or evaluation tool for the anxiety and depression. So anxiety, depression, bullying, is there a tool to assess them?
For the bullying,
Yes.
I'm I'm not aware whether there's a tool. Um, but perhaps what I would imagine what could help would it would be great if the company has policies against bullying and it's properly disseminated. And then perhaps employees could also have seminars that can talk about what to do and what not to do. Um, because there are times that I would see in the workforce actually that it may be cultural, but actually it's already bullying. Like one example that we usually see in the workforce that it's normal, but it's awful for like for a lot of people would be fat shaming. They tease, but it's not it's not exactly a happy thing to do. And when you look at it, it's already at the bullying side. Um, and
Doctora,
then
can you elaborate about the fat shaming for the purpose of our general audience? Ano
oh
bang ibig sabihin nun? Mataba? Ganun po ba?
yeah, like what I observe, it's usually the males joking to the females about their
Mhm.
weight, about their size. It
Alright.
comes off as a joke, but I myself, when I hear about it, it's quite offensive. And then they usually either do it to their colleagues or to somebody lower ranking to them. But of course, they never do it to the bigger
Is there
boss.
such a example of a dialogue, Doctora, so they can relate to it?
Dialogue. Sometimes when they comment about how much they're eating,
Oh.
I think it's parang, huh? You're eating all that? Sometimes they jokingly comment about, it's like, parang lumalaki ka.
I see.
Parang
As simple
ano,
as that.
yeah, I think it's it it some people may not be as affected, but some people may be. That's my opinion. So I don't know if other people would have like other examples of some something that is borderline bullying. I think one uh interesting case that I heard, because there's a law already about I forgot the term, but of the anti-bastos law. And there are cases where like for especially for women in the workforce, like some people make sexualized comments already. So I think we have to be also fully aware about that, because some people would always say na uh it's like boys will be boys, but actually it's like no, it's actually uh for me as a woman, I don't feel safe working in an environment that can talk about females' bodies like that. So quite honestly, um, I think other ways of bullying would be like openly shaming the person in front of everybody, uh, or particularly targeting a person that not necessarily has done something wrong. Um, but I think perhaps the companies should have specific guidelines and implement them, because at the end of the day, even if you have the guidelines, but if you don't implement them, I think people would end up knowing that, oh, I can get away with it anyway. Uh, that's what I would imagine. But again, I'm not exactly an expert when it comes to uh, what the workforce can apply. Okay. And then in terms of screening tools, yes, we have screening tools that we use in psychiatry. But
Mhm.
I think it would be very different in terms of using it in the workforce. That would be answered by our employees. Because when we come up with these types of screening tools, like I think we have to consider the language barrier. So some would need something that's in Tagalog. And for you to make a screening tool that's in Tagalog, of course, there are times that we have something that is in English. And then when we translate it to Tagalog, we have to do like a specific study for it so that we know the translation is accurate. And then at the same time, the wording that goes about it. And then I think also privacy issues, it's very important, especially with the mental health law. So we also have to specify that if we have this information, that we also have to respect the privacy of the employee. So there are a lot of considerations. So as of the moment, I'm not an expert, but as of the moment, I am not knowledgeable of a screening tool that can be utilized in the workforce. Or perhaps kami ni Winston, we're gonna look for
Please.
one. We're gonna see if there's something we can
Yes,
utilize. Yeah.
yes, let's
I think,
collaborate.
yeah, I think especially that now I'm the outpatient, and then eventually we're gonna be working together. So with his perspective of the workforce, and then my knowledge with psychiatry, perhaps we can like collaborate in a project that could be utilized for the workforce.
Yes, that is correct. That is a future plan, Doctora, no? But who do
Yeah,
you think would be the best focal person in the companies in the implementation of mental health policies and programs?
focal person. I guess the best would the best examples hopefully would come from the leaders, from the managers. Like what was suggested, it would be great if the managers, the supervisors are educated on how to identify employees with problems and how to deal with them, what to say and what not to say. Um, so I think especially that the company, it's more centralized. So it usually goes from top to bottom. So information dissemination comes from the leader, the manager, the supervisor to the workforce. Aside from that, excuse me, uh, aside from that, also development of programs. And then at the end of the day, your workers look up to the managers, to the supervisors. So I think if you promote mental health, you promote an attitude of like exercising empathy for your colleagues, I think it would trickle down to the rest of the workforce. And then especially if, example, you're a leader and you have a policy against bullying, I think with that, it would also set an example for those under you that, oh, we are more of a mindset that we need an environment that uh, that is against bullying.
I see. Doctora, would you advise to include in the pre-employment medical examination assessment tools on mental health? Bago pumasok ang empleyado, daan na lang siya ng mental health na assessment.
Well, I think there are some occupations that do that. Well, it's not exactly mental health. It's a neuropsychiatric assessment. So
Mhm.
for us at the National Center for Mental Health, I think also other departments of government, or not all, I think all departments of the government, for us to enter, we have to go through a neuropsychiatric evaluation. But from my experience, it does not necessarily
Mhm.
guarantee that a person is like mentally well. And these examinations, they say in general, it only reflects a person for 6 months because um, we tend to change. So we may have like a specific situation at the time of examination. And then as time goes by, we face other challenges. So it's not a permanent tool. Um, but I think in general, I think it goes hand in hand. So example, we bring in an employee, but we also I think the company has to take responsibility in taking care of the employee, and as much as possible creating an environment that makes our employees more productive. So it's not just, oh, we screen the potential employee for mental illness, but at the same time we screen and we provide a good and productive environment for our workers.
Is there a need, Doctora, to hire professional healthcare provider to facilitate mental health assessment for our workers? At enough na po ba yung self-reporting questionnaire as screening tools?
My opinion from uh dealing with our patients, I would suggest it would be great to have a mental health professional in a company, or perhaps a tie-up with clinics that offer these services to companies, because I think it's very challenging for anyone, uh, if not given the experience of interviewing these patients, it may be difficult to identify these types of disorders. Um, so it would be great if someone who has the experience, and then also experience, the knowledge, the training, to identify and to help these types of conditions.
I see. So, Doc, palalim na tayo ng palalim, no? Is there a way na some employees, ito muna mga example scenarios, some employees are anxious when they see their superiors. As a co-employee, how can we be of help? Pareho sila empleyado at maybe one of them would like to help the other person when it comes to their feelings kapag pumaharap sila sa kanilang mga superior. Is there a way that they can be a help? Or dapat i-refer na lang sa professional agad dahil meron siyang anxiety attacks? Ganun po ba yun?
I would have like I would have multiple questions about this employee. Like, in the first place, is it to a particular employer, superior? So maybe there's a reason why that this employee is anxious towards his superior. Possibly this employee is not performing well, and the superior already reprimanded him or her for that. If it's at the end of the day, anxiety does not necessarily mean it's a bad thing. Anxiety actually helps us identify danger. Anxiety is our body telling us to fight or fly. But it becomes a disorder if it's a source of dysfunction for us, if the anxiety is excessive for the situation. So I think, given those parameters, those are the questions that you would assess. So perhaps the reaction of the co-employee is a normal reaction to an abnormal situation. Because what if there is a situation that would give reason for your co-employee to experience these symptoms? But all of us experience anxiety, but we also have to assess whether the feelings, experiences are appropriate for the situation.
I see. Doctora, there are companies that have created certain checklists for anxiety, depression, and burnout.
Okay.
Are these enough?
I think it's if they have checklists. I'm sorry, I'm not an expert when it comes to what is being utilized in the workforce. But if you have already something like that, so perhaps it would be helpful. But again, even if you have those checklists, I think at the end of the day, the patient needs to be evaluated by a psychiatrist or a clinical psychologist.
How about suicidal tendencies? May screen po ba yun, Doktora?
Oh, yeah. Actually, there's screening for suicidal tendencies. But for cases like that, I think I do believe that is a psychiatric emergency, and you really have to refer your patient to a psychiatrist.
Is there a screening tool for that?
Yes. Actually, we have a program right now. We are developing a screening tool for suicide. It's a tie-up with the WHO. Um, but I'm not sure what step we are right now. I think it's still at the beginning of implementation because it was discussed a few days ago. Unfortunately, I wasn't able to attend that discussion. But yes, there are screening tools for suicide. But again, suicide is not taken lightly. You would have to refer your patient to psychiatrist.
Psychiatrist. Thank you so much.
Yes.
Is there a screening
Yes.
tool, doctor, or sorry, important points to consider in a mental health program during COVID?
Mental health program during COVID. I think number
Yes,
one is accessibility for our clients. So not everyone has access to good internet. And then I guess but aside from the accessibility, I think it's also it's a big opportunity because right now everything is online. So uh, I guess the thing that you can think of is what is the best platform to reach your clients. And
Yes,
then
true.
aside from that, uh, I think you would also have to consider um like the time spent for doing these programs. And then yeah, I think at the end of the day, it's like the time and the scheduling. Like what I noticed with all these lectures, all these offerings, like, wow, we can make programs on the internet. But then we forget, it's like people need free time. People
True.
need to disengage. People have to, when they're home, they would like to stop working. So at the end of the day, with the internet, we tend to forget, it's like, oh, this person has private time. Oh, this person would not like to talk about work at this certain time. Even like I would get messages about work on Sunday when it could be discussed, the next day. So um I think that would be one big factor that we would consider is to respect each other's time and to acknowledge that there are periods of time that our workforce would not like to think about work. It would like to spend time with family and be home.
That's true, Doctora. Balance is the key.
Yes.
What if the subject or the person with mental health problem is one of the top management? Example, CEO. Can we do something about it? Can a lower rank employee do in order to help the CEO? That's a question among the ating mga audience.
That's a very difficult
I know,
situation.
palalim na ang ating mga tanong.
Okay, so I think this is at the perspective of the physician,
Mm-hmm.
or well, as a lower ranking employee, this is out of my imagination na lang ha. Well, what the things that I would consider as a psychiatrist, the decision to seek psychiatric help has to come from the patient, especially with the mental health law. And then if there is a psychiatric emergency already, if the patient is not able to make the sound decisions for him or herself, the next person to decide has to be the spouse. So perhaps, there's like if there is no advance directive by the patient, the next one would be the spouse. And then if there's no spouse available, the next one would be adult children. If there are no adult children available, the next one would be the parents. And then if there are no parents available, that's the time you seek help from from the siblings. So there's like a hierarchy on who can make decision in behalf of the patient. So I think at the end of the day, the responsibility has to be with the family if your boss cannot make sound decisions for him or herself and is experiencing a psychiatric emergency.
All right. Thank you, Doctora. There are so many questions in our chat room, but this is one of the last questions that I'm going to ask, no? Okay pa po ba, Doctora?
Okay, yeah.
Okay. Now, who is responsible now for the for the purpose of our audience educational purpose? So, sino po ba ang responsible for the implementation of the mental program of the workplace? The HR office, guidance office, or the medical team in the workplace? Sino po ang kailangan mag-shoulder ng gastos if they will have a case? Is it the employer of the employee or kanya-kanyang gastos ba to dapat? Paano po ba?
Oh, that's a very difficult question in my part. But I think at the end of the day, this is me trying to put myself in the shoes of the company. But I think at the end of the day, it depends on what is offered to the employee. When the employee signs a contract, and then what is offered, like medical insurance and whatever, what is stipulated there that was agreed upon for that whether the company will shoulder certain expenses. Again, I'm not an expert. I'm sorry, I'm not an expert in terms of like applying mental health and what is the policy in the workforce. But it's something that is really interesting to tackle on. Maybe it could be like a subspecialty in terms of psychiatry. But like for example, if a person needs confinement in like for example in our hospital, and the company offers PhilHealth, it's already mandated that if our patient is eligible for PhilHealth, we enroll our patients for PhilHealth, and then the patient doesn't pay for anything. For what department is responsible to, am I correct, to like manage mental health issues in the workplace?
Yes, siguro ang follow-up question ko rin,
Whether,
Doctora, is
yeah.
if there's a patient na with a really case of a mental issue, sino
Okay.
ba ang unang nakakaalam or sino lang dapat ang nakakaalam? So probably yun ang ng purpose ng question na rin yun.
Oh, okay. I think my number one question is, did the patient seek consult with the company physician? Did the patient give information to the company physician? Did the patient give permission for the company physician to refer the case to a specialist? I think I would consider talking to legal in terms of the question na halimbawa, we have a situation that one of the workers has a psychiatric problem. Kasi personally, as a psychiatrist, I would be protective of my client. I would not easily give that information to just anybody, especially with the mental health law. But I am not sure what are the policies in terms of a company physician and what information was agreed upon to be for the top management to be informed about certain situations. I think it's a question that needs to be addressed by the company and maybe by the legal department, and perhaps agreed upon also by the patient.
Thank you,
I hope
Doctora.
I was able to answer the question. It's quite a difficult question, but I hope.
Thank you for answering. Opo, okay naman po, Doctora. Ang dyan kasi at the end of the day, ano po ba ang aming as company doctors, what would be our end point wherein where we should be referring our patient to a psychiatrist?
Okay. The endpoint is if you rule out a medical condition and you rule out the symptoms to be a cause of a certain drug or substance, and you know it's a psychiatric disorder, I would say refer to a psychiatrist for us to reassess, and then perhaps also recommend management for your client.
All right. And thank you so much for answering all the questions, Doktora. Any ano po word take home words po para sa ating mga audience?
Oh, at the end of the day, all these disorders, it's somehow like a coping mechanism, or because there are a lot of factors that come into play when we encounter these disorders, and I hope it will we would consider that it does not mean that person is weak, or that person is broken. I think, like I mentioned earlier, we have to exercise empathy, being open-minded, being understanding. How we explain mental illness, like there are a lot of cases there is imbalance of neurotransmitters in the brain. A lot of cases we cannot pinpoint what is the absolute cause, but we would consider genetics, we would consider past experiences, the environment, and stressful events growing up. I guess at the end of the day, if we have a way to help each other, especially when it comes to work, because these people living with these disorders, nobody asked for it, but being able to work and to be productive greatly elevate their self-esteem. So if we can give them a very a good environment for them to be productive, I think at the end of the day, we gave them a pretty good life. So thank you for your practice in occupational medicine, that you help our workers cope with their problems, especially during this pandemic.
Thank you, Dr. Tan. That was a very marvelous lecture po. I will give back the floor to Dr. Jason for the closing remarks. And stay lang po kayo lahat, and we will have our batian later. Greetings po, no? Stay tuned.
Thank you, Dr. Ku. Maraming salamat po ulit, Dr. Tan. At this point, I would like to thank our PCOM QCC virtual Kapihang team. Pinangunahan po ng aming technical head, our very own PCOM Secretary, Dr. Angelo Taylor. This webinar will also not be possible without our PCOM QCC CNE team na pinangunahan naman po ni Dr. Maria Cecilia Diana. Thank you very much as well. To formally end tonight's educational activity, ladies and gentlemen, our chapter vice president, Dr. Jeremias M. Florante.
Thank you, Drs. Cabigon and Ku. Okay. Since the start of this global public health crisis due to coronavirus disease 2019 or COVID-19, I believe that this illness is not just a respiratory ailment, but a mental health concern as well. Our Kapihang tonight is very timely as we have discussed how we are going to address mental health challenges of our workers, especially in the midst of this pandemic. Our heartfelt thanks to Dr. Kathyrn Natalie Uy Tan of the National Center for Mental Health for granting us her time and expertise. To our industrial partners in the field of occupational medicine, our colleagues in the field of occupational safety and health, and to my fellow occupational health physicians, thank you for participating in tonight's forum. To the national officers and members of the National Board who are here with us tonight, including the past national presidents, thank you very much for your support. Further, tonight after this Kapihang is the premiere night of the last month's 30th Kapihang OH entitled Compensating Work from Home Related Injuries via our official YouTube channel. So do not forget to like, share, subscribe, and hit the notification button to be updated of our new videos. Please do not forget to like and share our other social media accounts in Facebook, Twitter, and Instagram. We have also posted our latest edition of our Balitang OH in our official social media accounts for you to be refreshed of what happened in the last semester of this year. Balitang OH is our official digital newsletter. Should you have concerns, requests for placement of advertisements in our Balitang OH or topics for the next Kapihang OH, please do not hesitate to contact us at PCOM Quezon City Chapter at gmail.com. Lastly, to those who wish to join and learn on how to develop your own online health declaration form and link it with COVID-WAIR report being submitted to the regional offices of the Department of Labor and Employment for a minimal fee of 750 pesos only, enroll now with our Kalamang OH by registering with the QR code shown in your screens. To our occupational health physicians who are here with us tonight, again, let me invite you for another educational experience with AstraZeneca Pharmaceuticals Philippines on leveraging budesonide for Motorolan asthma. This August 27, 2021 at 7 o'clock in the evening. Please check on your screens the login details of the video conferencing platform used for the said event. Again, always remember that in Quezon City Chapter, we value your safety and health. Hashtag PCOM QCC cares. Thank you. Stay safe. Good night, everyone.
Thank you, Dr. Ferrante. Let me promote again the rerun of our first module of our Kalamang OH, the Creating an Online Health Declaration Form. This is actually due to insistent public demand. So nag-rerun po tayo ulit. So kindly get the information if you're interested to join. Also, our symposium entitled Leveraging on Budesonide for Motorol in Asthma on August 27, 7 p.m. Again, I would like to invite everyone to like our official Facebook page, follow our Twitter and Instagram accounts. Please don't forget to like, share, subscribe, and hit the notification button of our official YouTube channel at the addresses shown on your screens. Muli, maraming salamat sa inyong pagdalo. Sa susunod na 32nd Kapihang OH, ako po si Dr. Jason Cabigon na parating nagpapaalala na sa Quezon City Chapter, ang inyong kaligtasan at kalusugan ay mahalaga. Hashtag PCOM QCC cares. Good night everyone and stay safe and healthy.